As I get more into technology as a doctor, I realize we are missing out on so much information and data on our patients' lives that actually affect their health. You see, seeing me every 3 to 6 months during, say, a 10 to 30 minute appointment, I'm only getting a snapshot of your life, meaning just a glimpse of time. Now, does that lead to me making the best decision about a person's health? Well, welcome to the world of remote patient monitoring. Today, we're talking about 3 reasons to do remote patient monitoring. What's up, San Antonio and world? I'm Dr. Qasim Butt and I'm a kidney doctor, and I'm here to break down health in a simple way. Now, over the last few years, I've gotten involved in remote patient monitoring as nephrology medical director of Leo, makers of the Smart Patch, so I've gotten kind of a glimpse into this world. Remote patient monitoring is literally remotely observing a patient's labs, vital signs, and/or physical activity. This is typically done through a device like a blood pressure cuff, a blood pressure monitor, or a watch. The devices that do this are typically Bluetooth, Wi-Fi, or cellular enabled, and are able to take information directly to the cloud or a server so that someone at your doctor's office can see it. This allows for more continuous log of your health, taking your health information from a snapshot in a doctor's office to a real-life movie about yourself. Now, this is something that's particularly beneficial to the population that I serve who have chronic kidney disease or who are on dialysis. This population is prone to electrolyte issues, fluid issues causing shortness of breath and leg swelling, erratic blood pressure and blood sugar, and higher rates of mortality. So, why would you do this? One reason is because intermittent care kind of sucks. Let me give you an example. Let's say blood pressure. Every time you go to the doctor's office, they check it, right? But the issue is we are human beings. We're not a set number. We exist in ranges. Blood pressure can vary throughout the day. And quite honestly, can be off when you come and see me in the office for various reasons. For instance, if you're anxious when you see me or forget to take your medications that morning. Getting more accurate readings in your natural environment can lead to better dosing of medications. Prevent hospitalizations. Oftentimes when you go months without seeing a patient, things can change a lot, especially if they have multiple medical conditions or are elderly. What if their condition worsens over time without the doctor's knowledge? Well, this can result in a hospitalization, which not only puts the patient's life at danger, but is also incredibly expensive. If you have more monitoring of a patient, especially if those without, say, the means or social support, the thought is you can keep them out of the hospital and get them seen by a doctor or provider sooner. Reimbursements are available. Now, in order to change doctor behavior, you're going to have to change the incentive models and the incentive structure, how you pay them. Now, Medicare actually has payments for these services called RPM payments, remote patient monitoring payments. This allows practitioners to bill for monitoring of blood pressure, pulse ox, blood glucose, and weight. Now, these are available through Medicare, Medicare Advantage, and some commercial insurance as well. Now, they typically have some stipulations are required for these payments as far as needing at least 16 readings a month to qualify and having a certain level of time documented reviewing this data. But the key here may not be the revenue they bring into a doctor's practice, but rather the cost savings that arise from doing more value-based care in the form of less hospitalizations and better lives and outcomes for patients. In my opinion, whichever device you use, it should not interfere with the daily life or behavior of a patient. Also, whatever user interface or platform that's on, say, a laptop in a doctor's office that's used to gather this data and display this data to a doctor's office, it must fit into the clinical workflow of that doctor's office and not feel like a burden to the members of that office. Now, the key here is not just getting and recording metrics on patients, but what the doctor does with that new info, and does it lead to actionable change and improvement in patient care. And remember, it's your kidneys, your health.